Unfortunately, disabled people face a number of accessibility barriers when navigating a built environment, and this prevents us from enjoying the same opportunities as non-disabled people. And this is despite the recognition that all deaf and disabled people have the same right as non-disabled people. So one of the key accessibility barriers, and let me clarify that when we talk about accessibility, we do not just talk about physical accessibility, we also talk about accessibility in terms of meeting the needs of deaf people, people who are neurodivergent, people who have any medical condition for which they identify as disabled, people who have experienced mental distress or mental trauma. So this is really important for me to say. So one of the key accessibility barriers from our perspective is the inaccessibility of the street space. We know, unfortunately, there are still obstacles on pavements, clutter, dockless bikes, e-scooters, and also the design and state of roads is often a big challenge for people with visual and mobility impairments. There are often not dropped curbs in some areas, which means that entire sections of the pavements are no-go zones for wheelchair users. Often there are no alcoves or benches. That means that people are unable to stop and rest. There are disabled people who can cycle, by the way, and the cycle infrastructure is often inaccessible with narrow lanes that cannot be used by tree cycles, hand cycles, and other non-standard cycles, and also lack of storage facilities for non-standard cycles. These, of course, are just some of the accessibility barriers. I could talk for ages. But when we look at public transport, of course, there are a series of accessibility barriers. We know, unfortunately, that just 92 out of 270 tube stations are fully accessible in the sense that they offer step-free access. Buses, even though they are most affordable and accessible form of transport, are still present a series of challenges for disabled people. One of the key issues is that the bus infrastructure is often poor. There are no seatings for people, and this is a key problem, for example, for people with chronic fatigue who might need to rest while they're waiting for the bus to come. And also, we have received so many concerns by people with visual mobility impairments around bus stop bypasses, because their design is a problem for many people, because they're expected to step onto a cycle lane in order to get off the bus and get on the bus. And then our focus has been on housing and how inaccessible the state of housing is, not just in London, but across England. And all disabled people have really the right to live in inaccessible homes that meet their needs. Unfortunately, we know that this is not often the case, and living in inaccessible homes is really a postcode lottery. I just wanted to say that in London, the situation is slightly better compared to the rest of England, in the sense that we've got higher accessibility standards, we've got accessible housing targets in place, but disabled people still find it really hard to find accessible homes. And specifically, there is a shortage of accessible housing in social housing, which is the tenure that disabled people disproportionately need and live in the most. We don't have to forget that disabled people are more likely to be living in poverty compared to non-disabled people. And if we look at just at London, over 30% of disabled Londoners live in social housing compared to 10% of non-disabled Londoners. So there is clearly a need of increasing the supply of accessible housing across all tenures, but specifically in social housing. And we think that the GLA, through planning, has a key role to make sure that we deliver not just more homes, but the right kind of homes for all, and we can also make sure that all barriers, disabling barriers to active travel and public transport, are actually removed to make sure that all disabled people can live independently. I wanted to maybe talk a little bit about the policies which are in the London Plan, such as policy D5 on inclusive design, which we really welcome as a policy because it basically says that all development proposals need to submit a design and access statement and then needs to be accompanied by an inclusive design statement. So in principle that is great, but the policy needs to be implemented locally, otherwise there's no point of having a policy in place. So what we see is that there is a limited understanding sometimes amongst developers, the regulatory profession, the construction profession, even local authority around what inclusive design principles are, what they mean in practice. And unfortunately, as Hayley and others were talking about, there isn't meaningful co-production with deaf and disabled people locally. And what that means is that we end up designing places which are discriminatory by design, and we build inequalities into places while we could prevent that if we just spoke to people locally. So I just want to say that. And the last point is, we do not think that inclusive design is really a strategic priority of the London Plan, so maybe this is what should happen in the next iteration of the London Plan. And if I just look at housing, for example, why do we have as KPIs the supply of affordable homes and the supply of new homes as KPIs, but the supply of accessible homes is not a KPI? Surely, disabled homes are being built each year, and how many we need every year, right? So we need to make sure that the success of the London Plan is also measured against the number and the quality of accessible homes that are being built. So I'm going to stop there. Yeah, I just want to echo what has been said already, but add that in addition to prioritizing investment in step-free access tube station, what we also would like to see is an investment in zero-emission buses with enhanced accessibility features, such as those where we have a bigger access space so that we make sure that more than one wheelchair user can get on the bus, and we avoid conflict with buggies. This is often a big problem that is raised to us. So I just wanted to say that. And then cycling infrastructure needs to be accessible for all disabled people. Bus stops need to be safe and accessible. We want to raise the fact that we need to hold the development of bus stop bypasses until there is meaningful engagement with DDPOs and deaf and disabled individuals, because that hasn't happened. And I think this is a big problem. And I think Hayley was talking about training, right? We need to make sure that all staff receive disability equality training delivered by deaf and disabled people and based on the social model of disability, rather than what is happening at the moment, which is an EDI training not delivered by disabled people and not based on the social model of disability. So this is not equality. This is a tick box exercise, and it's a problem. And then adequate bus infrastructure. Nobody's mentioned toilets. You mentioned toilet. Free, accessible, and changing places toilets at tube station, not just when the London Plan addresses this and says that large development proposals need to make sure that there is provision of accessible and changing places toilets. But what about tube station? Are there any toilets there? Are they open? Can be used by people with wide variety of impairments. There is signage. People don't know where the toilets are, so this needs to be improved. And last point I want to make, the transport chapter states that 80% of all journeys need to be made by active travel, which means walking, wheeling, or cycling, which we agree with, but there must be some recognition in that chapter that some people, because of their impairments, cannot, unfortunately, walk or wheel or cycle. So we want to make sure that any sort of policies that promotes active travel is based on the idea that some people with impairments cannot really use public transport, for example, and because otherwise we still create disabling barriers to disabled people. So I was at the event yesterday as well, and I shared the same concerns. I don't think I've seen many equality groups there, and I don't think it's because the equality groups didn't want to be there. It's because they weren't being contacted. So there hasn't been proactive engagement, and I think the people in the London Planning for London program really need to reach out properly to different equality groups, which is not just disabled people. There are many infrastructure organizations in London, like the LGBT Plus Consortium, EU Better Initiative, Women's Resource Centre. There are so many infrastructure organizations that could have been there, but I don't think they even knew that these events was even going on. I really want to stress, though, that consultation is not co-production. So I think these events are good, but we need to come to a point where we realize that we need to go to communities and understand what people's needs are, and do not expect people to provide feedback on a predetermined set of questions or topic. We need to come with a blank sheet of paper almost and ask what the needs are, and together work with solutions. And sometimes we don't feel that is happening, so we would actually like to see co-production happening. And Inclusion London is also a member of the London Housing Panel, which is also an initiative part of the Planning for London programme, and through that we and many other DDPOs are trying to make sure that accessibility is a key priority of the next London plan, or the next, we want to see more accessible homes being built anyway. Mayor of London set up a DDPO forum, which is an engagement forum that meets every kind of 3 months, and is made up of a wide variety of DDPOs in London. So that was supposed to ensure that there is meaningful engagement with deaf and disabled people around everything, yeah? So that forum should be used to ensure there is strategic engagement. And, for example, it doesn't always work like that. So events like that yesterday, maybe channeled through the DDPO forum, would have been welcome.
Right.
Can I make a few comments on housing and how we could improve policies in the London plan, because I wasn't able to talk earlier. So I think, so I think there should be a focus on retrofitting the existing housing stock. So we should make sure that the accessible housing target do not just apply to new build homes, but also to extension, to acquisition. So the current mayor is, through the right to buy back scheme, or the new CHAP program, I think it's called, the Council Acquisition Program, is giving money to local authorities to buy back properties from the private rental sector to convert them into social rent homes. Can we make sure these homes are accessible? So maybe requiring as a funding condition that local authorities conduct an accessibility assessment of these homes when they are being acquired, and retrofit them to the highest accessibility standard. Also, I think people were mentioning this earlier, there is a difference between fully wheelchair accessible homes and wheelchair adaptable homes. A wheelchair adaptable home is not readily usable for a wheelchair user to move in. So the kitchen and the bathroom are not cannot be used unless they are adapted. And that means people have to apply through DFG, and local authorities spend lots of money, which is not really cost effective, to adapt new build homes that could be made fully wheelchair accessible. So I think we want to see targets being introduced for M43A and 43B, because we really want to monitor to what extent the wheelchair user homes which are being built are actually accessible, fully accessible or adaptable, because we are concerned that developers are more likely to be the wheelchair adaptable because it saves them money and it's not really cost effective for the public purse either, and not good for disabled people. Affordability was mentioned. We want to see, of course, accessibility across different tenures, but more accessible social housing. And so we think that the GLA should really monitor, when they monitor affordable housing starts and completion by type, how many of these are accessible. We don't know that. And to what extent these accessible homes that are being built are affordable. Again, we don't know that. The 10% applies across all tenures. So maybe a larger proportion of accessible homes should be in social housing. I wouldn't be able to tell you what percentage, and that's where data comes in. I think the GLA, we have analyzed the London Housing Strategic Market Assessment from 2017, and there is scarcity of data around people with protected characteristics more generally, LGBTQ plus people, ethnic minority communities, disabled people. So we need to make sure that the GLA captures the identified unmet housing need. We want to know what is the current situation in London, how many new or not new homes we need which are accessible. Why do we know just, for example, the Mayor of London said 66,000 homes are needed every year. of these, a certain proportion needs to be generally affordable. Why can't we know how many are needed every year that are accessible? This is really key, important information. But if we don't have this information, how are we expecting even local authorities to plan and deliver the right kind of housing? We are quite skeptical.
The real challenge seems to be joining everything up. So you have a planning authority that will meet certain standards for the building, but then real life, as Harriet was talking about earlier, as you come out of your house and you go onto the street scene, and then you're going to have to cross a road, then you're going to have to get on transport, then get into a shop, then get back, then get money to pay for things in the shops that you may or may not be able to get into. So it's finding some standards, some agreed sort of, I don't like to use the word baseline principles, but what's acceptable? How should businesses operate? How should planning operate? Is there anything more, he opens the door on this one, that you suggest government should be doing? I mean, around that planning process especially, and the built environment. I know we've touched on it already quite a bit, so Laura.
Yeah, so the government actually launched a consultation on raising accessibility standards in 2020, and last year they actually committed to raise accessibility standards. So M42 is going to be the new default option for building new homes in England, but hasn't been implemented. So we would like to see those changes implemented, because if you delay the process more and more people are going to be living in a suitable accommodation. And also I think in terms of we think that there should be a proportion of wheelchair accessible housing being mandated because unfortunately it's really post-collateral. Not all local authorities are actually building wheelchair user homes.